Thanks for choosing Morning Live. Now, one of the 5 people in Gauteng who have tested positive for the coronavirus is in a critical condition. The 57-year-old man traveled to Austria and Italy and returned to South Africa on the 9th of March. Now, the Department of Health in the province says that the patient suffers from renal disease. The designated hospitals for isolation in Gauteng are Maxeke, Steve Biko Academic Hospital, as well as Tembisa Tertiary Hospital. So to discuss further the situation, at least in Gauteng, and of course more generally some of the questions that you have posed, I'm joined by Dr Bandile Masuku, who is the MEC for Health in Gauteng. Thanks, and we appreciate you coming through this morning.
No, thank you, and thanks for having us, and good morning to your viewers.
Dr Masuku, let me just start with a question that the regularity of which has been quite surprising, where people keep asking, what does self-isolation entail? And when should people do this, if at all?
I think there are basic questions that we need to actually clarify, because you should, in terms of screening, there should be some positive response to 2 questions. Whether you have traveled recently, particularly to countries where, like Italy, where there's the outbreak has actually caused mayhem, and it's also that you have been exposed to those who have actually traveled and who have been infected. So in our case, we're talking about 13 actual individuals in South Africa, and it means that anyone who has been in contact and has been traced as a contact of the 13 has been seen and has been actually notified and given some few guidelines. And one of them is actual self-isolation, meaning that limited exposure to individuals who are coming from outside who are not infected. And this, it also takes, I think, around 14 days, because you have to go through a period of incubation and make sure that your swabs are actually negative. And we are confident that the only numbers that have been positive are those who have been exposed and those who have been traveling, and the contacts recently have not been found to be positive.
So just to wrap that particular question, when you are self-isolating for whatever reason, if you have come into contact with some of the people who have tested positive, you obviously need to eat,
Yes.
You need other services. So how do you interact with people then?
So the ideal situation is that when you get somebody who's going to help you to give you food, they must also be actually covered or protected. The basic one that we use in that instance would be a mask. And this is a basic hygienic aspect that we need to follow in general without the outbreak of coronavirus. Even when you have got a general flu, this is what we need to do to limit the exposure, limit contacts. People must protect themselves with masks and have a room that is properly ventilated. And that's how we would do it. But there are guidelines, and NSID has got guidelines. The hotline might be able to help some individuals who need more questions, or particularly in different scenarios, because the scenarios might not be the same.
Dr. Masuku, coming to the situation in Gauteng, has there been any new developments? At last check, there were 5 confirmed cases that tested positive in this province. Is it still the same?
It's still the same, but I just wanted to correct one factor about the 57-year-old. The actual fact, the person who's actually doing quite badly is a patient that he's around the north, in the northern actual suburbs, the younger gentleman. But when I called this morning, they told me that he's actually recovering well and he's actually getting better. The gentleman, the older gentleman, we are only worried about him because it's a high-risk group in terms of age and in terms of the comorbid actual disease that he has, which is a renal disease. And he's still doing well. He's not, in a real sense, in a bad situation. That I just wanted to correct that fact.
So the patient you're referring to, the younger patient in the northern suburbs, what is his condition? Is he in critical condition?
He is improving. Yesterday he was not doing quite well, but he's improving. This morning when I spoke to the doctors, particularly those in our infectious unit, promised, and they gave an indication that he is actually recovering quite well.
So speaking to patients who may contract the disease and they already have compromised immune systems or have other conditions such as renal disease in the case of the 57-year-old, what sort of impact does this coronavirus have on them?
The information that we have now in terms of the research that has been published says that any person with a comorbid disease, which is called like that, meaning an underlying disease that has been pre-existing, usually they have a severe pattern of, of the disease progression. But I think those who have been just as a first time sick and with the outbreak, they normally do well. And they've also noted that those who are younger and fitter, they've got a very benign disease pattern.
So what about the other 3 patients? Because we have 5 patients who have tested positive in Gauteng. You've given us updates on 2, the other 3?
Remember, the other one we discharged from hospital on Tuesday, and she's home. And I went to see her in Johannesburg, in Charlotte Maxeke, and she was very well without any symptoms. And the decision of the clinical team was that she might do much better at home. And she's also on strict isolation, as we've said, or what we call self-isolation. And we are waiting for the last swab from her in terms of the negative tests.
So that would make it 3. There's 2 more?
The 2 more, they are still stable and quite fine where they are in terms of symptoms.
And with regard to just tracing the people who have been in contact with these 5 people who have tested positive, do you have any update on that?
The tracers are about to complete all the contacts of the 13 actual people. I think they're going to complete the process this afternoon. And all of them have been in contact, and it's not really a very huge number. We have been training a big team in terms of the tracers because we need to be ready for them to do that. But we have people who've got experience in terms of tracing. You'll remember that we do tracing and tracking for TB and adherence and HIV and AIDS adherence. And I think that experience has come in very handy.
And there is, of course, also a concern that the number of cases that we have seen being tested could actually speak to a situation where the situation around COVID-19 may be slightly worse than we think in terms of, the number of people who could be positive. You are, obviously part of that interministerial task team working on containing and dealing with this virus. What is the take of the team on this?
I think so far we are quite confident on the tracing that we have done and the testing that we have done, and we feel that we have been able to contain it within the 13. There are a few things that we might introduce going forward, which might be stricter in terms of restrictions, but it's something that we need to consider actually going forward. Like something that refers to a mandatory isolation for particularly people who just recently came from countries where the outbreak is actually rife. So those are the few things that we need to do. Other people have suggested, that we need to declare a state of emergency. At the moment, I don't think we are in that scenario. I think we are in a scenario that we can have lighter restrictions, which would still be okay for the business to continue in the country, for the economy to continue to work in the country. And we are considering some of those.
Because if you look at the announcement made by the US President Donald Trump this morning on travel restrictions to Europe, and you look at South Africa's response, and when people see measures being taken in other countries, then they start to question our own government's response and start to ask whether we are perhaps being a bit lackadaisical about the situation.
No, I think it won't be okay to follow what Mr. Trump says. It's something, but I think what we need to follow, it's what the World Health Organization gives us as particular scenarios that we need to follow and understand, and they've developed quite a good guideline on different scenarios for countries that don't have infections at all, that have got fewer infections as imported infections. So they've given us a good, actually scenario planning that we are working on, and we are following it up. And what also is important is that we're continuously in contact and in discussion, and as a per situation arise, we'll then have a particular, measures that are put in place. Like I've said, the one on just for those who are coming back from Europe, that we do the same as we're going to do with those that were repatriating. Keep them or do some self-isolation until a particular time that they are cleared.
Is there any update on the repatriation process from Wuhan City?
They have actually, landed, and we're hoping to get them back into the country tomorrow night. And this is, they've posted some pictures of the team that went there on social media, and they seem quite jovial and in a good spirit mood. And they are going to be tested before they come. And I think one thing that is important about this is that we need to say to the public of South Africa that we are not repatriating people who are sick, people who have tested positive coronavirus. We are only repatriating those who are well. Those who are repatriating are well, and they will be tested, and they've been tested negative before they get into the plane. They will be tested again, and they will be actually quarantined or isolated when they get into the country. So we just need to make a proper information actually sharing here.
So if the returnees test positive by any chance on the screening before they get onto the plane, if they test positive, are you going to leave them behind?
No, there will be steps taken for them, because remember, it's also part of the whole process that there will be steps taken for them to be repatriated, but not now with the same group that is there. So there will be a different modality on how they get repatriated back to the country.
And you mentioned earlier, Dr. Masuku, that you visited Charlotte Maxeke. What is the state of readiness to deal with the eventuality, or let me not say eventuality, because we don't want to see this, but if there were to be, more cases testing positive, are they ready?
We are developing spaces. There is a space that is ready for a bigger group and actually numbers, and the space would be able to handle that. But one thing that is important that we need to say here is that we need to also appreciate that we are learning some of the things, and we are improving the systems as they are. The team that took care of the first patient, they've actually gave us a lot of things that we need to consider of us taking it forward in terms of improving. But
such
in Tembisa, one of the things was just a common thing that is supposed to be common sense to us as medical practitioners. The utilization of our own equipment and stethoscopes that will just be within the area, not be taken out and be sanitized there. So those are few things, and also the issue of the space and the ventilation aspect of it.
What about Steve Biko and Tembisa?
Tembisa, they've got, it's not a very big space, but they've got a two-bedded space that is there, and it means that they will only be able to cater for those who are in transit or those who are just limited in number. Steve Biko, they've got a bed, almost a 7-bedded ward, which also has got the capacity to do ICU trial management.
And it is change of season now. We are going into the autumn months here in South Africa, and sometimes this comes with flu-like symptoms. I beg your pardon as I say that. I almost display it, but and we read a story earlier about actor Tom Hanks was talking about these very flu-like symptoms, and he and his wife Rita Wilson both tested positive for coronavirus. So how do we deal with these situations?
So the principle of screening, it has to, you have to first, it's staggered. So you have to have some positive responses in terms of the questions that will ask you, and say, have you traveled? Have you been to Italy? Have you been to countries where they have exposure? That's one question. And the second question would be, have you been exposed to any of the people that have traveled and who have been actually tested positive? That's the second one. So if those two are positive, then definitely it means that we must then start to put into place a system, or the one of self-isolation, do a test, and if it's confirmatory, then we continue with the management. And that's how it should be. It's like, a simple thing about a pregnancy. A man who's feeling nauseous in the morning shouldn't think that they are pregnant. So those are few things that we need to also be logical and be fair to the system and to everybody else. That nobody must just rock up in a facility and say they want to be tested for corona, even if when they've never been exposed to anything.
So in other words, be vigilant, but don't be paranoid.
That's the most important message, and it also means that we need to infuse a bit of logic and calmness in the whole thing, that you have to have some positive responses to the screening questions, and those screening questions will lead us to, we do that, the screening things consistently and in various scenarios, even the mental state examination, we do have some few questions that we ask you that will determine that you are going to need further help or further assessment. So screening, in a sense, gives us a sense of filtering those who in a real sense will require the testing.
And just a final one on the returnees on that repatriation mission from Wuhan tomorrow night. So how will that work, and are you able to disclose to us at this point where they will be housed?
Unfortunately, it's a military operation by and large, even in terms of their transport, even in terms of the information and where the location would be. And I've seen a lot of news articles suggesting different places, but I think we'll have to keep it in that way so that we don't also create a stigma, around it. One thing that I've also discovered, that those patients who have been infected with the virus, they also feel that we need to keep their identity private and confidential. We'll also like the media to actually to maintain such etiquette, just to keep their information, their names and everybody outside the public stare, so that we keep their privacy okay. Because sometimes the stigma itself would, with the paranoia, it will cause us actual problems even for the patients themselves.
Dr. Bandile Masuku, thanks for your time this morning. MEC for Health in Gauteng, talking to us about the coronavirus situation and update on the condition of some of the patients who tested positive here in Gauteng. It's time now for your 7 o'clock news.